My name is Dr. Joanie Winstead. I am a graduate of the prestigious Palmer College of Chiropractic in Davenport, Iowa. I am a board-eligible chiropractic neurologist with over 300 hours of postgraduate neurology through the world-renowned Carrick Institute in Atlanta, Georgia. I also have in excess of 150 postgraduate hours in functional medicine and metabolic testing through Apex Energetics. These classes include functional endocrinology, functional blood chemistry, neurotransmitters in the brain, and mastering the thyroid. As a member of Dr. Michael L. Johnson's neurology group, I confer with over 500 doctors on cases of chronically ill patients. Dr. Johnson is the author of What to Do When the Medications Don't Work, a non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. And I have been in private practice in Carthage, Mississippi since 2004. Now today I'm going to talk about thyroid condition and what makes us different than any other doctors you have seen and how you can finally end your thyroid nightmare. See, we treat patients metabolically and neurologically, and I'm going to go over that in more detail in just a moment. So did you know that some 20 million Americans are affected by thyroid disorders? That's 1 in 13 people, and more than half of those people are unaware they even have a thyroid problem because it is frequently undetected until it gets severe. And according to the National Women's Health Information Center, 1 in 8 women will experience a thyroid disorder during their lifetime. The reason why this fact may surprise you is because you've probably never heard it explained to you. That's because most doctors are only vaguely familiar with thyroid disorders. So let me ask you this. Are you tired of running from doctor to doctor only to play Russian roulette with different medications? Here, try this drug. Well, that didn't work. We'll try this one. And are you tired of taking drugs that don't fix the problem? Do you continue to struggle with chronic thyroid symptoms day in and day out? Well, here's a list of symptoms. Some of the symptoms of hypothyroidism is number 1, fatigue, tired, or sluggishness. 2, cold feet and or hands. Number 3, do you require excessive amounts of sleep to function? Do you gain weight easily? Do you have difficult or infrequent bowel movements? Are you depressed? Do you suffer from depression? Do you have lack of motivation? Do you suffer from morning headaches that wear off as the day progresses? Do you suffer from thinning hair or excessive hair falling out? Do you suffer from dryness of the skin and or your scalp? And do you suffer from mental sluggishness? That's hypothyroidism. The symptoms of hyperthyroidism are heart palpitations. Do you have inward trembling? Do you have an increased pulse even at rest? Are you nervous and emotional? Do you suffer from insomnia? Do you suffer from night sweats? Do you have difficulty gaining weight? And Hashimoto's thyroiditis is a combination of hyper and hypothyroidism, and it is an autoimmune disorder in which the patient's immune system attacks the thyroid. Patients that suffer from Hashimoto's experience some or all of the above symptoms. Now let's talk about the thyroid gland a bit. The thyroid runs our metabolism. It is the gas pedal of the body. Thyroid hormones have direct effects on most organs, including the heart, which beats faster and harder under the influence of increased thyroid hormones. That is why heart problems can often accompany chronic thyroid problems in women, and perhaps heart problems are more common in women under the age of 50. T3 is a more biologically active hormone. It is more important for cellular function. And in fact, most of T4, which is 80% of it, is converted to T3 in the body's peripheral tissues. So T4 is just a precursor for the more active hormone T3. That's why when your doctor runs a thyroid panel, they must run more than just TSH. I see it over and over again. So many doctors are only doing TSH and the people are not getting well. Well, one of the problems in some thyroid disorders is that you may have problems converting your T4 to T3 in your tissues. Have you been checked for this? This can create a deficiency of T3, which is disrupting the body's ability to properly regulate metabolism, leading to specific symptoms. There are some clinicians that are treating thyroid conditions with iodine. In my opinion, it's one of the worst things you can do for your thyroid conditions. I have attended numerous seminars taught by Dr. Datis Karazian. He is the author of the book, Why Do I Still Have Thyroid Symptoms? and he states that using iodine to treat thyroid conditions is like throwing gasoline on the fire. So I'm here to offer you new hope. You are watching this video because you or someone you love suffers with thyroid conditions, and I promise to leave no stone left unturned. So if you're tired of dealing with this problem and you are worried about it getting worse, then fill out the information to your right, and I will send you a free DVD that will show you how we treat our patients neurologically and metabolically. We will leave no stone left unturned to determine the exact cause of your condition. Thank you, and I look forward to helping you return to health.